Good afternoon. It's once again 5:30 on a Friday, and of course, this is your host for the next 25 minutes of Hotline 21, the most interactive television show in not only Chicago but anywhere, because we get an opportunity to talk with you, but we also get an opportunity to listen to you. We're coming up on a holiday, Thanksgiving, and I just had a wonderful day out at the Prosser Career Academy, which is a high school on the northwest side of Chicago. I had lunch with the principal and the members of his staff, but I also had lunch with the student government leaders, and then we had an assembly with other members of the student body, and they were all just wonderful, just great young people. I tell you, it made me want to be 15, 16, 17 again. But they could look at my hair and know that that was not the case, but it was great. Our number's 312-738-1060. We are going to keep talking about the Affordable Care Act. As a matter of fact, I know some people have heard a great deal about it, and some people may be even tired of it. But you know, when you compare the health status of people in the United States of America with that of people in other industrial countries, although we are the wealthiest, we are the most technologically proficient, we provide some of the best services, health status is how you measure the quality of life of a whole group of people. We come up quite short. And so we have Miss Geryl Kramer in the studio with us, who has a belief that and you know, it's interesting, we had this very same discussion in the Ways and Means Committee just the other day with the chief administrator of CMS, who is actually in charge of implementing the Affordable Care Act relative to young people and the need to get them enrolled. A lot of young people seem to think that they are invincible, that they don't need health care, they don't need health insurance, they're not going to get sick. If they do, they're just going to kind of self-cure, and then magic, they'll be okay. Well, let me thank you for the interest that you have expressed. And could you tell us a little bit, tell my audience a little bit about yourself?
My name is Geryl Kramer, and I'm actually in the import business, and so I have my own health insurance. And first of all, I want to thank you. I actually called your office because I had a concern on my health insurance, okay,
All right.
and a complaint. But your office was incredibly receptive, okay, and I've always believed that our government officials are. After that, a light bulb went off in my head because I care very much about health care. For many years, I've had times when my parents could not get health care or people couldn't get it. And now we have an opportunity where everyone can get health care. And what's happening is the chatter out of Washington and the chatter in Washington, D.C. is clouding the whole picture. And what I kind of tell people is that chatter, and my friends have to hear this every day, that chatter and the fighting is really about the people right now who have the insurance. Someone like me, did our premium go up or down? But there are many people who don't have insurance now who never had the opportunity to, and they should not lose sight of this opportunity. To me, we have framed this as, for young people, it's a punishment, or we need them to sign up for the old people. Young people should sign up for one reason and only one reason. It is right for them. It is right to protect your health. It is right to protect your financial assets, even if you think you have none in the future. They used to always say that you could have a savings, and then all of a sudden, it's gone.
Wiped out.
One accident or whatever, it's wiped out.
One swell swoop.
So to me, this is the first step of financial planning. And the other thing, and it's not only young people, everyone's going to have an opportunity here. People who had pre-existing conditions before, people who think they can't afford it can now either through Medicaid or through subsidies get it.
So even if you're a type 2 diabetic like I am,
I
can
remember
go.
that from before.
You can go and get it.
And young people who think they don't need it, definitely, or those who won't get the subsidies. Let me say this: if you're not going to get the subsidy, it's because you're making enough money that after you have your food, your clothing, your rent, your next thing should be health insurance.
So you're saying it's for the needy and not necessarily the greedy?
Oh, it's for everyone. And I can promise you the other thing. No one has a crystal ball. So if you say, well, I'll get it later, if you knew you were going to get ill on December 25th, 2020, you could wait till December 24th, 2020 to sign up for health insurance. You do not know when you're going to need it. And if you sign up now, you have so many more options. You only have to sit in an emergency room and have someone tell you you have a bad illness and you don't know where to go. And you don't have the options of different doctors, or let's say you got diagnosed with some rare disease and some hospital in one of the suburbs is the best. If you don't have insurance, you don't get access to these hospitals. So this is just planning for your future.
All right, I think we got a caller on the line. Let's see what our caller has to say. Caller, are you there?
Good evening, Dr. Davis, U.S. Representative, 7th District. This is what I want to say, all right? If you don't think about yourself, at least think about others. The reason why I say that, if you're a person, you plan on getting married, okay.
Who, me?
You may be able to cover your wife or your child.
All right, I was kidding a little bit.
But I want to say this, whatever. If when you get a certain age, whatever, all right, what happens, you wind up have to have minor surgery, like something like appendicitis. And you know me, Dr. Davis, like I have a vision problem. There's young people I see every single day, through no fault of their own. They wind up having have to have some type of surgery, maybe cataract. You know, there's no age limit on terms of cataract, or that to have a retinal attachment. All those things is very, very expensive. If you don't have the coverage, you may not get the type of care you may need.
You know, you mentioned having a vision problem. I was over with the Chicago Lighthouse for the Blind the other day.
Very good foundation.
Oh, let me tell you, it was such an inspirational. They just got the contract to manage the call center for the Illinois Tollway. And
yes, I heard about a lot of people with vision problems. They are hiring people to work those toll booths and other positions as well.
You are
so
right.
That's giving them some type of hope. And some of the training the state is doing in terms of helping people with disability, it's a little bit better. It can improve, but it's a little bit better. But what I'm saying, getting back, would say, if you don't have health insurance, okay, unless you're going to be a hermit, you know, you're going to need it for your wife or for your child.
Can I add something?
All right. You want to add something to what he's saying? Go right ahead.
Your caller is absolutely right. When young people, if you're going to focus on young people, if they don't sign up for insurance, first of all, they might get married, they might have children. But more important, and I don't know if they really realize this, if you don't sign up and you get sick, you can wipe out your parents' finances because your parent is not going to let you go without health care.
And I'm going to make one quick point, Dr. Davis. If you have a baby and it don't have no type of complications, do you know how much it cost is to have a baby?
You know how old I am?
Well, it's possible. I see it on Jerry Springer. There, a guy that's 80 years old.
All right.
Because you got a little snow on the roof, that don't mean nothing can't be burning down in the boiler, you know what I mean?
All right.
Getting back to, it can cost as much as $16,000 or more.
Okay. Well, thank you so much. We are talking about health care and the difficulty of getting young people to actually sign up, to enroll, or to believe that it's necessary. I mentioned a little bit while I was talking to these young students at PRASA. You know, teen health clinics have been established at many high schools, and I was pleased that I was a part of establishing the first one in Chicago, as a matter of fact, which was the PATH Teen Health Program at Austin High School, that I guess was established more than 20 years ago. Since then, we've got clinics at many high schools, and so that young people get accustomed to health care, to looking after. There was opposition when we first started promoting them because some people thought the focus was on family planning and that it was all about sex education, but it was more about health education than sex education. And I think people are understanding that now, and they're beginning to buy into it more. So I wish we'd get a call from a young person who might be watching and see what their thoughts are on the issue. But we'll go back to the phone. Oh, okay. But if there's some young callers out there, give us a call.
And can I say something, else? And I think there's two things. Young people probably don't realize how much they need this. And the other thing is it's very cost effective because today, now I don't have this, and I didn't have this in my policy. There is a lot of preventative care in your policies and a lot of like exams. Like if you want to go for a female exam or if you want to go for your annual exam. So you might be paying premiums, but then you're not going to pay for these preventative incidents. So in that way, there's a cost payback to it. But the other thing I would like to say about young people, and this is more to our government than the young people ourselves, we're assuming, and not just on young people, that everyone understands how to buy insurance. And to me, that was the biggest mistake, website or not, okay? If you said to, I went to a friend of mine, very successful, and so I assumed she knew how to do financial planning. And I assumed she could do things like she knew what an IRA was and a 401k. She thought a mutual fund was an IRA. People are not even familiar with the jargon. And this was a friend my age. So we're saying to people, even if they think they might need it, if you don't know what a deductible was, and very interesting, Congressman Davis, I spoke with my insurance agent before I came here. A lady my age said, what's a deductible? Okay, so we're saying go to a website, and young people are used to clicking and checking and looking at a spreadsheet, and I'll pick this, and I will argue they don't know what they're picking. So when I was talking to your office, your poor Caleb had to listen to me, and I said, Caleb, number one, we have to convince people this is financial planning. Number two, we should, and the website actually has some, I did just check, but there's some better places. People should not just buy on a website. When I look at real estate, I go to realtors.com, but then I go to a realtor to show me around. I would recommend that people go to the website, make your questions. What is a deductible? What is a copay? None of these are stupid questions. None of them. Then look for some help. Ask either your parents. If you work, ask somebody in human resources. Find an insurance agent. I don't want to go on the website and click for 45 minutes. I have my insurance agent come to me. She makes a chart of 3 or 4 plans. If I qualified for a subsidy, she can tell someone. And then I pick from there. She knows what are the best insurance companies. So you should always look outside the web and then go back to the web to make your decision. But I would not just click and pick.
All right, well, let me tell you, it's kind of difficult. I am saddened because I discovered today that in all likelihood, I am going to have to switch providers because where I get my health care is at the Union Health Services down at Polk and Ashland, right across from the University of Illinois. It is a union-owned health center. and they are very good, and they've been very good. There are only 4 carriers that are national, the way we have to get. And so I really spent part of the morning trying to find out if there's any way that I'm going to be able to keep my coverage. And it looks like I won't, which means I'll be very sorry. And I'm saddened. And I told the executive director that they've got some of the best doctors I have encountered. And I wanted to give them a great commendation for and I know a great deal about health care. I've been involved in it a long time, but I've been absolutely pleased with the personal health care that I have gotten from this group of providers. And I'll just have to decide where I go. Do I go to Blue Cross? Do I go to Aetna? Do I go to United Healthcare? Or do I go to Kaiser Permanente? I don't think Kaiser does much in this area. But, we'll do something.
But
you had developed a whole bunch of
points of
Yes,
why you need it. One was it is protection. It's not a punishment. It is the first step in financial planning, and it really is. It protects your most valuable assets, you, your health, your family, and your finances. When you save money, there is nothing worse than seeing it dissipate for something like an illness. It is also now, it is preventative. It'll keep you healthy because of the preventative aspect of this. I also said it was a win-win situation. And this is what, I am probably the most overinsured person. I have long-term health care, disability insurance. And so if you totaled how much I'm laying out, I do remember my dad, when I was 23, I said, I'm getting disability insurance. He says, why do you need it? We'll always protect you. He could not afford to protect me financially. I would have wiped him out. It is a win-win situation because insurance, if you waste the money and don't need it, you are blessed. That means God gave you good health.
Now, let me ask you, though, about your own business.
Mm-hmm.
Tell us a little bit about it. We've talked about all these other things. What is your business exactly?
I am a manufacturer's rep, which means I represent different companies. And they're importers, usually from China and India. And so we make... I sell rugs, shower curtains, table linens to the corporate offices of like Kohl's, Crate and Barrel, Carson's, Home Goods. And so as an independent contractor, I've always had to get my own insurance and all that.
Well, that sounds wonderful. I've been to China, never been to India yet.
India is fascinating. I love the people. I love the country. They're very bright, very creative people.
I spend a great deal of time with the Indian community. And we go to, civic functions. We go to political functions. We go to banquets. As a matter of fact, I think Gerard and I were at one a couple weeks ago. And we had great Indian food and got a chance to talk to the people.
Well, you know what? Maybe this just reminded me. Maybe you can give a message to the president. Because I'm sure he's going through a hard time with the ACA. The Indian people have a saying, everything will be all right in the end, and if it's not all right, it's not the end yet. So, you know
what? I am going to see the president next Tuesday night, and I'm going to remember that, and I'm going to say that to him.
And what I want is, I have to tell you, I have mixed feelings on the ACA, and not to get political, I believe one party wasted 40 years doing nothing, maybe putting out a few position papers, but when they had the House, the Senate, and the presidency, you didn't see them fighting for health care. The other party, I think, overreached on this one. Okay, I had a $5 million cap. I'm not sure we needed unlimited caps. We could have had a $5 million cap with an inflation COLA in it. But okay. But when I realized I would rather you have overreached and I will fight the issues I don't agree with, but that everyone has an opportunity to get insurance. And going back to the young people, my mom and dad, my dad was an independent person. And when you couldn't get health care, my mom and I were at lunch. She had had cancer, and she thought she was going to get on Florida State health insurance. She was crying at the table because she was excited she was going to get on it. My sister and I were holding our breath for 3 more weeks. We didn't know Florida State was going to have health insurance. So to those young people who have not signed up, first of all, it is for your benefit. And you only have to go when you can't get it. And should we ever take down the ACA, whether I agree with it or not, being able to get it now is a gift. And everybody should take advantage of this gift.
Well, let me tell you, for the more than 30, some people say 40, some people say 50 million people who've never, ever had an opportunity to have health insurance coverage during their lifetimes. I'll take a little glitch any day. I'll take a little struggle. I'll take a little misadventure for those individuals who, without it, never would have had anything except the opportunity to go to the Cook County Emergency Room and get health care. So, yeah, we've had our problems, and the president's been under siege, but that too shall pass before the end. And since we haven't gotten to the
Yes, everything will be all right in the end, and if it's not, it's
fine.
not. And can I just say something else?
Quickly, because we've got less than a minute.
Okay, I was helping somebody, and they were going to be on Medicaid. I called your navigators. You don't wait. They don't say press 1, press 2. They were helpful. I would be using the phone before I would be using the website anyhow.
Well, let me tell you, you've been very helpful and so refreshing because you're telling people how they can make the most effective use of something that they've never had before. And so I want to thank you as an interested citizen. I mean, you're not promoting your business. You're just talking public interest citizenship talk. And we're so appreciative. So thank you very much.
Thank you.
Our time is about over. We've got to get out of Dodge. We'll see you next week. Okay.